Title: Statin Use and Risk of Dementia or Alzheimer's Disease, a Systematic Review and Meta-Analysis of Observational Studies. Published in the European Journal of Preventive Cardiology, March 2022. Introduction: Statins are medicines that help lower cholesterol levels and are widely used to prevent heart-related problems. They are crucial in treating a condition called atherosclerotic cardiovascular disease, which is linked to the hardening and narrowing of arteries due to cholesterol buildup. As more people face high cholesterol levels, the use of statins has increased globally. Studies have consistently shown that statins are effective in preventing major heart issues. For every 1 mole or L reduction in LDL cholesterol, statins decrease the risk of cardiovascular events, coronary events, and coronary artery disease death. While their primary role is cholesterol reduction, statins may also have other positive effects, such as anti-inflammatory and antioxidant properties. However, concerns about statins affecting memory and cognitive function have been raised, leading to the US Food and Drug Administration issuing a warning in 2012. Despite this, large-scale trials haven't found a clear link between statin use and dementia, though smaller studies provide mixed results. This study aims to conduct a comprehensive review of various studies to better understand the relationship between statin use and the risk of Alzheimer's disease and dementia compared to those not using cholesterol-lowering therapies. Method and results: researchers conduct a search in medical databases, such as PubMed, Cochrane, and Embase from their beginning until January 2021. They sought studies that met specific criteria, studies comparing people who use statins to those who don't. 2 studies focusing on Alzheimer's disease and/or dementia as outcomes. To analyze the gathered information, the researchers used a method called a restricted maximum likelihood random effect model. They measured the effects using something called odds ratio along with 95% confidence intervals. The combined results from 36 studies showed that people taking statins had a lower risk of dementia, with an odds ratio of 0.8, and a lower risk of AD with an odds ratio of 0.68. When they looked at the results for men and women separately, there wasn't a significant difference in dementia risk reduction. They also compared different types of statins and found that both lipophilic and hydrophilic statins had similar effects on reducing the risk of dementia and AD. However, high-potency statins seemed to be a bit more effective than low-potency ones, showing a 20% reduction in dementia risk compared to 16%. This suggests that the stronger statins might be more helpful, but the difference was borderline significant. Discussion: a recent analysis of 46 studies looked at the connection between using statins and the risk of developing neurocognitive diseases. The good news is that not only did statins not increase the risk of these disorders, but they were linked to a significant decrease of 20% in dementia risk and a 32% reduction in Alzheimer's disease at risk. This positive effect was consistent in both men and women, with a similar reduction in dementia risk for both groups, 24%. These findings align with other recent studies that focused on people aged over 60 without cognitive issues at the start. Most participants in these studies were middle-aged adults, an important age group for preventing cardiovascular disease and possibly influencing cognitive function in the years to come. Our analysis also revealed that the positive effects of statins persisted in individuals at a higher risk of dementia due to older age. We further divided our analysis based on the type of statins used: hydrophilic and lipophilic statins, and found that both types significantly reduced the risk of dementia and AD. Contrary to earlier studies which suggested lipophilic statins had a protective effect, our results indicate that both types are equally effective. Additionally, our data hinted that high-potency statins, like atorvastatin and rosuvastatin, might be slightly more effective in reducing dementia risk compared to low-potency statins. While the exact mechanism by which statins affect cognition is not fully understood, it's believed they might impact brain cholesterol metabolism, reduce oxidative stress and inflammation, and improve blood flow. Treating hyperlipidemia, particularly in midlife, could potentially reduce the risk of dementia, supporting the idea that statins' positive effects may be related to lowering LDL cholesterol levels. However, this hypothesis may not apply to all forms of dementia, and further research is needed to clarify these aspects. Despite these positive findings, it's essential to acknowledge the limitations of our study. Differences in diagnostic criteria for dementia across the included studies and potential biases may affect the generalizability of the results. Observational studies, while valuable for providing long-term and rare adverse effects data, are susceptible to biases and confounding factors that are challenging to control. Our study underscores the need for cautious interpretation of these results, as further research is needed to validate our findings and understand the long-term effects of statin use on cognitive health. Conclusion: the findings from this recent and comprehensive analysis of observational studies provide reassuring insights about statin use and its association with dementia risk. The results suggest that statins are unlikely to be a cause of dementia or cognitive decline. This supports the idea that statin treatment is generally safe for adults and the elderly, aligning with existing evidence on the positive impact of statins in preventing cardiovascular events. The study also supports the current guidelines emphasizing the use of statins for secondary prevention in older individuals and primary prevention in those up to 75 years at very high cardiovascular risk to prevent cardiovascular events. However, when it comes to using statins to prevent dementia, the study acknowledges the limitations of pooled data from clinical trials and the inherent bias in observational studies. As a result, the findings don't provide enough support to make a recommendation regarding the role of statin therapy in preventing dementia. In conclusion, the study suggests that for strategies targeting aggressive lipoprotein management and statin use to prevent cognitive decline in the elderly, specifically designed randomized clinical trials with larger populations, longer follow-up periods, and standardized methods for diagnosing dementia are needed to draw more conclusive evidence. Any research topics you'd like us to cover next? Let us know in the comments. And as always, like and subscribe.